Hey, it's that time again for the truth. Glad you could stop by to see what was going on. As always, I want to encourage you to go to this link right here below, and if you would go to that website, in the upper right hand corner are the icons for all of the social media platforms where we post our podcast. And any of those that you have an account on, if you would go and you would subscribe or like or follow or whatever the verbiage is for that particular social media site, please help us to get our numbers increased. And also on this website, if you scroll to the bottom of the page, you'll see a place where you can sign up for my newsletter, and that way you won't have to worry about missing an episode. It also gives me a tool to use to get things out to you, maybe in between podcasts, information that is maybe relevant to whatever's going on in the world today. So I appreciate that. I wanted to talk today. It started out relatively simple and just kind of kept snowballing from there. But the recent shutdown of the government, and the crux of that really, or maybe it was just me that struggled to understand the whole issue with the subsidies, because I never really paid attention to that a whole lot, because I was only on Affordable Care Act coverage just for a short period when I first moved to California, and California has an awesome, they call it Medi-Cal, not Medicare, but Medi-Cal, and I was able to get on that and had, I thought it was wonderful coverage until I found a job there in California, and so then I was covered by employer health plan until I retired, and then I was on a Medicare plan. And so I never really had to worry too much about all that, the subsidies and that sort of thing. So as I started digging into it, I came up with a couple of things, and so we're going to talk about a few things along the way. First of all, we're going to start out with some of the issues about the Affordable Care Act in general. So the Affordable Care Act was passed, and then these enhanced subsidies came along that President Biden enabled, and that's kind of where we got to today. So here we go. We're going to talk about the Affordable Care Act. And one of the things that we were told was that the Affordable Care Act would increase economic growth, and it really did do this. There was a certain level of employees that if you had more than that number of employees, you had to provide them health care. And if you were below that number, then you didn't have to. And so what some companies, if they were right near that, they either cut employees or they made some of them not full-time so that they didn't have to pay that money to provide health care for all of their employees. And so we didn't see that economic growth that was talked about. Medicaid would be an efficient way to increase coverage. And the Affordable Care Act's Medicaid expansion turned out to be far more expensive than what was projected. And I kind of laugh because it's like, yeah, when was the last time that any of these projections were right? Every time we have any kind of large expenditure in our government, there's all these predictions by this group, that group, the other group, the government accounting office, whatever. And I don't know if they're ever really right on by the time things get all done, moving through Congress and, excuse me, and getting passed. So we were told that if you liked the plan that you were already on, and if you liked the doctor that you had, that you could stay with that. And that, again, turned out not to be true for various reasons. The insurance companies canceled a plan, or they combined it with some other plan. Things changed, and so they weren't static. And so some of those plans that people wanted to stay on disappeared because the insurance companies said they're going away, or the plans changed and the doctor said, oh, I'm not going to accept coverage from that plan, again, for whatever reason. The individual market would become a competitive marketplace. That didn't turn out to be true. Enrollment, by some calculations, was only about half of what was projected. And so when you have, you project a certain cost here because you expect this many people, when you get a lower number, then just you spread that cost out over a lower number of people, then it becomes more expensive on a per person basis. And so that never came to fruition either. The ACA would decrease emergency room use because these people now had insurance. Well, the thing was that a lot of those people who were used to going to the emergency room, because that was where they had always gone, because they didn't have a doctor in a clinic or a doctor's office that they could go to, they just continued to go to the emergency room, which is, any of you that have ever gone to an emergency room know that their costs are much higher than going to your primary care physician. But people didn't make that connection. They said, oh, I got insurance now, I'm going to go to the emergency room and get fixed. And so they did, and that kept the costs really high. The Affordable Care Act would ensure end abuses by health insurance companies, and I'm not sure who thought that would ever happen. Insurance companies are in the mode of making money, and it doesn't mean that everybody is abusing the system, but there's definitely problems there, because we see a lot of reports continuing to come out, and this is true of long-standing programs like Medicaid and Medicare and Social Security and some of those that there's problems abounding. So we can't assume that the Affordable Care Act is somehow going to magically, mystically be perfect. A couple more of these. The Affordable Care Act was going to help cut the deficit. And I'm not sure what the student loan provision thing is. I really didn't follow up on that, so I don't know what that was. But the Affordable Care Act did add significantly to the federal deficit. We heard a lot about every family was going to save $2,500 a year by the Affordable Care insurance. And part of the problem was that that particular provision called the Cadillac tax, and again, didn't delve into that, but it never went into effect for reasons that I don't know. Also, the premiums did double, nearly doubled from 2013 to 2017. So this idea that every family is going to save $2,500 never came to pass. The Affordable Care Act would save lives. Now, I don't know who put. Well, I'd have to go back and look at my sources, but to throw that in there, that somehow that was the fault of the Affordable Care Act, when the years they're talking about are 2021, 2022, and 2023, when we were dealing with COVID-19 and the high death rates there, and so you really can't place that on the Affordable Care Act, that somehow they missed the mark and life expectancy went down. The Affordable Care Act would be a program only for U.S. citizens, but we know now that there are many undocumented immigrants that are receiving coverage through the Affordable Care Act, and that is one of the places that there's disagreement right now. The Affordable Care Act would take stress out of shopping for health insurance. Yeah, I don't know if any of you remember that original debacle of a website, but I think it has gotten better. Like I say, I haven't had to deal with it at all, so I don't know if it's gotten any better or not. There was also penalties that were going to be placed on employers that did not provide coverage for their employees, and that was going to provide massive amounts of revenue. And they never implemented that, or never went after those employers that did not provide health care coverage. So that revenue never came into the treasury, never materialized. So just some problems there that with the Affordable Care Act. But again, any of these kinds of programs, when Social Security first started up, when Medicare, Medicaid, and I don't agree with everything about the Affordable Care Act, but it got passed, and there's things that we could do to fix it, but that's beyond the scope of this particular podcast. There are definitely some problems with it as well. So, but one of the things that as I was digging through all of this, I couldn't quite grasp what was going on with this whole controversy with the subsidies and stuff. So I went and I finally, it took me a long time, but I finally found an example, and not all of the numbers were there. So this chart I'm going to show you is from this example that somebody doing some research created. Again, I'd have to go back and look at my sources, but I was able to fill in the gaps. So this is what we have, and along the top are just the years. Notice there is a kind of a gap between 2014 and 2018, just because it was seriously repetitive. This example is looking at an individual whose income is 200% of the federal poverty level, and that's the first row. So it stays same throughout. This example also assumes that this individual is always at that same level, 200% of the federal poverty level. And so that's their adjusted gross income is in that second row. Now, the third row shows how much of an increase from the previous year. So under 2018, you see $1,140, which is the total increase from 2014 to 2018. So that's actually spread over 4 years. So, and then, but still, 2020 in this example, they had a $700 raise in between 2019 and 2020. And again, you get up in 2023, 2024, and those are some significant raises. And I would struggle to believe that people at that particular income level get those raises of $1,400, $1,500, $2,000 a year. But if we look at the next column, the percent increase, again, under 2018, that's a 4-year. But you look at the other ones, the increase isn't that much until you get, again, to 2023, 2024. But overall, from 2014 to 2025, 2025, that increase is 3.87%, which the average wage increase in the country for that same time period was 3.79. So, but that was average. So under insured premiums, so there's the annual premium and the monthly, so it's the annual amount divided by 12. The premium paid percentage, that 6.3, 6.34, 6.54, that is a number that comes from the federal government. And so based on 200% of the federal poverty level, making whatever is on that second row, the adjusted gross income, that's the percentage that you are expected to pay of your income for health insurance. And so those rows below, the monthly payment, which is in green, that's what monthly an individual pays in this scenario. The ACA premium in under 2014 was $328. So you pay $120. The total premium is $328, which means that the government, the U.S. government, pays the $207.36, and so on. So it goes until we get to 2021. Now you'll notice that you only have to pay, again, we're talking about somebody at the federal poverty level of 200% with this particular adjusted gross income. They're only going to pay 2% of that now. And this came about through the American Rescue Plan Act that President Biden signed. So it was for 2021 and 2022, and then it was extended in the Inflation Reduction Act in 2023. And I'm not sure why, when they extended it to 2023, 2024, 2025, why they stopped at 2025. I don't get that. Why didn't they just say, okay, we're going to just keep this going? But I've read some articles, people said they did it on purpose so that they would have some leverage at some point, political leverage. I don't know. I'm not going there. So you'll notice that in 2021, the amount that it's in kind of the pink. So you went from $135 a month in 2020 to $42 a month in 2021. That is like a third of what you were paying. Amazing. Good stuff. And so 2022, 23, 24, and 25, you see the same kind of a thing where it's only that 2%. Now, the orange on the very right side, that is the problem point, because in 2026, those subsidies, the 2% subsidy is supposed to disappear. And so there's two columns there for 2026. One shows the calculations. If they extend those subsidies and they continue on that path, you'll pay $52 a month for your insurance, and then the government pays the rest. If those subsidies go away, which is the very last column, notice you'll pay 6.6%, which really, if we go back to 2020, and if you think if that would have continued on its path, that the premium paid percentage, 6.49 in 20, it's not that big of a deal to get to 6.6 in 2026 unless all those intervening years you've only been paying 2%. And anybody that tries to budget your income knows that tripling a particular item in your budget. So if you're paying $50.20 in 2025, they're in the pink, and all of a sudden you have to pay $172.15 a month in 2026, that's going to mess you up. That really is. And so that becomes the problem. And I'm not any kind of financial genius or anything, but I do believe that if the Republicans simply let these lapse, that's going to bode well or poorly for them come the November elections. I think that, you should probably taper those off somehow. And, I don't know whether you do that 1 year, 2 year, 3 years, 18 months, I don't know. That's above my pay grade. But to just say those subsidies are going away and, bite the bullet, again, when you look at the problems, the affordability problems we're struggling with right now, and I get it. I get that, you hear all this stuff about, this being better or that being better or whatever, but you talk to Joe Blow on the street and they're not seeing all the goodness. So anyway, I thought that was a great chart, and it helped me because I'm a visual person. So when I see stuff like this, it makes a lot more sense to me in that perspective. We could talk about the Affordable Care Act and whether it's good, whether it's bad, things that are wrong, things that are right. We can talk about the subsidies, should we or shouldn't we, and whatever else. But there was another big question that kind of came to my mind as I was digging through stuff, preparing for this, and that's the insurance companies themselves. The insurance companies continue to make record profits. Just man, billions of dollars. Look at this. Here we have two charts. In the one on the lower right-hand corner is the revenue and the profit for 2023 and 2024 for the 7 largest health insurance providers in the United States. And there's not a column for 2025, but I'll tell you what, in looking at the numbers, it would be even more larger profits than what they had in 2024. Just out of control, it seems. The other chart shows the compensation in 2024 for the CEOs of these 7 companies. Together, they made $146 million in compensation. Just crazy. This month, 1 quarter being 3 months. So 1 3-month part of 2025, United Healthcare, they had projected $9 billion in profit in 3 months. All right, 3 months, $9 billion. And they only made $7 billion. And the Wall Street Journal starts running around doing the Chicken Little thing. The sky's falling, the health insurance companies are in a bad way. A bad way? They're making $7 billion in 3 months. I don't think that's a bad way. I get it that companies in a capitalistic society are supposed to make money. I mean, that's part of the deal. But to see them making those kinds of profits when we struggle with people that are struggling with everything, healthcare, food costs, fuel costs, whatever, it just seems to me like something it's just not right. And I'm not one to say, oh, we need to regulate this company or this industry or something. I don't think regulating industry works very well, and that's not what we want to do. But so that was kind of what I wanted to talk about today. The Affordable Care Act. I don't believe it's going to go away, but we can fix it. But Congress has to work together and quit bickering politically over this and that and the other thing. I do agree that we should not just chop off those subsidies and say tough it out and let them jump 2.5 times or 3.5 times, from $50 a month to $170 a month. That's not right either. And I cringe when I see companies making that kind of money and individuals, the CEOs, making that kind of money. Not saying it's bad. It just like I struggle with that when people are struggling and having the financial difficulties that they're having. So anyway, that's all I got, and hopefully you learned something. I learned a lot as I wandered through all this stuff, and we will catch you later. Thanks so much.